Good afternoon. We'll now call the meeting of the Waco City Council, March 17, 2020, to order at 3 p.m. Welcome guests. All council members are present. Please join us for a moment of silence. Thank you. We will now recess the regular session and convene the work session with a report from the City Manager.
Thank you, Mr. Mayor. Good afternoon to you and all the council members. There have been several changes to the agenda today and to some other things if we look out in the audience here. And I just wanted to run through a couple of those changes. Resolution 2020-188 has been delayed to a future agenda at the request of Magnolia. During the work session today, we will only be covering the coronavirus update by the Health District, and then the planning public hearing items by our Planning and Inspection Director, Clint Peters. Under employee recognition, I'm excited to introduce y'all to our new Fire Chief, Gregory Summers. Greg, would you please stand? He is retired from the Little Rock Fire Department in 2018 after 34 years of service. He served in many capacities with the Little Rock Fire Department, most notably the last 9 years as the fire chief. During his tenure there, they became an ISO Class 1 city and also received the very prestigious accreditation standard, a distinction only held by 87 fire departments in the United States. Chief Summers is also proud of the increase of his work in increasing the diversity within the department. During his tenure, he's a member of the Omega Psi Phi Fraternity Incorporated and has been married to his lovely wife, Jeanette. They're sitting right next to him. For 34 years, he has 3 adult children, 3 grandchildren, holds a BS degree in emergency management and an AAS degree in fire science. Please join me in welcoming Chief Summers to Waco, Texas.
Chief, we're really glad to have you and your wife in our city and look forward to getting to know you and serving with you.
Under formal reports today, there is one Waco Convention Center District Bureau of Governance model structures update there, and we'll be happy to answer your questions.
I don't have any questions, but I do want to thank staff for providing this report. I know I'm the one that requested it at the last council meeting. This really helped me give me the background information that I was looking for. I know a lot of these discussions took place even before I joined council, and so Assistant City Manager Deidre Emerson, I appreciate you getting this report to us, and so I look forward to the conversations that we're going to have at the 31st council meeting, but this report definitely provided a good foundation for us to move forward with this, so I just want to thank you for providing it.
And to that end, to follow up, Hector, I think, yeah, because most of it pointed towards at least a brief background on it, a one-pager, and then with the knowledge that we're going to talk about it more at what was the 31st, but now it's the 22nd, I think, April? 14th? April now.
Oh, thank you.
Thanks.
Fluid situation.
End of the meeting might be.
Week.
It's this point of view that's throwing me off.
All right, here we go. Take a deep breath and let's see if I can't do this correctly here. Okay, on Thursday, March the 5th, District 5 Councilmember Jim Holmes held a community meeting at the Lake Air Montessori School where citizens of that district were able to ask questions and hear from the city staff on a number of topics. The 2020 Complete Count Committee held a press briefing on Thursday, March the 12th. To kick off the first day, residents all across the county can go online and complete the simple 5-minute census for the address they live in. The mayor and several city council members, as well as members of the Complete Count Committee, were on hand to use one of the free kiosks that are available at various locations to make it easy for everyone to complete their personal census information. Today, we're happy to probably show you the new image, we wanted to anyway, live, of the image that we're now doing for the sign language team that's being inserted in our telecast. Unfortunately, we weren't able to pull all the technical stuff together with a little bit of what's going on today. We're continuing to explore new ways to provide closed captioning for all of our programming on the Waco City Cable Channel, and we'll keep updating you on things like that. But we are doing the live insert today, so I'm wanting to sign people to smile pretty. The Municipal Information Department sent out our first e-newsletter on Tuesday, March the 10th, to over 8,000 residents. For anyone who didn't get the initial emailing, they can opt in by going to the city's website and to the homepage, and you'll find a link that says sign up. Our plan is to keep the information short and important to our citizens. The first issue featured a link to the short videos that we've created about the 4x4x4 brush ordinance now in place. It'll always have a link to notices and opportunities, meetings and events, interesting Waco trivia, a link to our City Talk podcasts, as well as links to some of the featured programs on the Waco City Cable Channel. Always included will be a key contact list for easy access to city services. No commercial ads, pop-ups, or links will be attached to the city staff-produced e-newsletter. And coming up here on March the 22nd is the District 5 cleanup. And that completes my report.
Thank you, Larry. Lots of good information. Obviously, we're in a little bit of an unusual time, to say the least, and the next report will be even more interesting. But thank you for all you're doing, and I want to say, especially with regard to the census, that kickoff may be getting lost in some of this coronavirus coverage. This is a great time while you're at home to take advantage of the opportunity to fill out your census online. Many of you will have gotten your invitations by now, but even if you haven't gotten your invitations, all you have to do is just go to the website, go to whyicountwaco.org, and you will find a link there to access the census, and it really takes between 5 and 10 minutes to complete. It is very, very simple, and there are no questions about citizenship. So I would really encourage you take this time to do that so we can get a complete count. Thank you.
Mayor, if you'll allow, I wanted to give a special shout out to our City Secretary, Esmeralda Hudson, and her staff for the diligent work that she's been doing and tremendous effort that's been made to getting the information out about Census 2020. I mean, they are really, really working hard, but to reiterate, this is that time, if you're not a social media person and you don't do internet, get on the phone. Fill out your census over the phone. Or, you know, I got my letter in the mail, go ahead and self-respond. I know I did it before I got the letter because I just entered my address because that's what this is about. So, but I wanted to take some time to make sure we highlighted staff for their diligent and dedicated work to the census.
That's right. Great point, Andre. Thank you.
I had one question. Larry, is the District 5 cleanup scheduled for Saturday, or that's all still on, right? This in my district, that's why
I have not heard contrary to that. Because I think that's picking up at residents' homes, curbside, that's business as usual, I believe.
Okay.
We'll find out and check on that.
Yeah, let us know.
We'll verify that.
During this meeting if we know that it's not going to be there, because, all right.
Great.
Okay, thank you, Mayor and Council. Thank you, Larry, for that good report. There are 26 resolutions today. The first resolution I'd like to highlight is 2020-186. This covers the general election on May 2nd, 2020.
I did want to go on record. I did have some questions, and I want to make sure that we look into details about some of the concerns that have been raised about this resolution. I know that was looking at the dates, and I see that there's no Sunday early voting date in the early voting schedule. And I know Souls to the Polls is incredibly important in our community. And I know that even in this time where, you know, fluid and nimbleness are our words because we are not sure what's going to happen, I did want to go on record in saying that I strongly believe that we need to put the Sunday voting day back. I also would ask that we consider really looking at the laws. The laws dictate that the polls have to be open 8 hours, but it doesn't say just 8 hours. And I know we have some things that are going on, construction and all kind of business that maybe would hinder people from getting to the polls by 5 o'clock on early voting days, and especially since we are trying to practice social distancing and add some space. I think we may need to consider a little bit more time. So that's something we can have discussion with our county elected officials and especially our election coordinator about. I think that would be meaningful and beneficial for our constituents.
And in addition to that, while I agree with everything that Mayor Pro Tem Barefield said, I would also would like the conversations to begin about putting an early voting location in South Waco. There currently is not one. And so, which is very important to my district and the people that live in those neighborhoods. And so as we have those conversations with our elected officials and as we have those conversations with our elections office, I want that to be a part of the conversation as well about getting an early voting location in South Waco.
Thank you.
Okay, thank you. Resolution 2020-187 approves the format and terms of the proposed petition, service and assessment plan, the assessment rate for the Waco Tourism Public Improvement District. You've received a copy of the presentation this afternoon that was originally scheduled for the work session today. This item will remain an action item on tonight's agenda.
So I have one question on that, Wiley. The draft service plan, quote unquote, that's in the materials from this afternoon?
Yes, it's in the presentation.
Okay, and that's not going to take place, but we've got it somewhere, right?
The
The presentations were recently emailed to you.
yeah.
This afternoon?
Yes, sir.
Yes.
Okay. But okay. And we're still going to vote on it tonight
Yes.
without a review? I guess we'll review it at some point this
We can.
afternoon. Individually?
This evening, if y'all have some questions, if you have some questions now, we can try to respond to them. But what this does, it establishes really the format and the basis for the consultants, and Bradley, correct me if I'm wrong, to bring back an impact fee structure to the council.
This one's the T-PID, right?
On the TPID.
Oh, this is I'm sorry. I'm talking about the TPID. So this establishes the TPID and the assessment rate, which is 2%, I believe.
Which I'm supportive of, I just
Right.
haven't seen the presentation.
And
But,
so as part of that process, the different percentages for sales and marketing administration, how that is broken down, how we utilize the 2% that we receive is, and it's identified in the presentation that was emailed out to you today.
Can somebody copy that out and let me look at it this afternoon? I didn't bring my computer with me.
We can do that.
Great.
And I'm sorry, I got those.
That's not,
I'm
I
gonna
knew
be
what
on
you were
the
talking
other item
about.
I was telling you about here.
I knew what you were talking about.
Also, under Resolutions 2020-189, recommends the proposal from Turner Behringer Development for the Floyd Casey Stadium site. And again, you have the presentation that was going to be made relative to that one. And we've got this on the agenda for action this evening, and we can take any questions you might have on that one.
When will the presentation be made to council for Resolution 189?
Not today, but
Right.
we would like to move forward with the negotiation with them, so we could get you to approve that this evening. Then we could come back and bring a full presentation to you.
Okay. And the reason I ask is because I know there were going to be some people, if they're not here already, present for that presentation today. But we just want to let them know that we'll reschedule for a later date. And I know they're very excited and curious to see what we're doing with that development. And so I look forward to the presentation on a later date.
Okay. Thank you, council member. Resolution 2020-190, this is the bid award to Gibson and Associates for the Waco Suspension Bridge Rehab Project. This is the total amount with a 7% contingency is $13,279,135.50. And I imagine, as most of the council is aware, this is significantly more than we originally had budgeted. We are recommending that we award this bid, pull about $8 million out of our surplus, out of our unassigned dollars, to fund the project because we believe the project needs to move forward. And then the next resolution, the very next resolution, allows us to reimburse our unassigned dollars in a future bond issue.
I'll just comment that, yeah, I think we need to do this. I mean, it's the, primary landmark in the city of Waco, so we need to get moving on this. I know that the bids came in way high, so we kind of tried to get creative on how we could get it done with a limited amount of funds. So I appreciate staff's work on all this. Ultimately, I think we need to go forward with what's here, and I agree with how we're trying to finance it too. What I had a question on is the timing, and on page 242, there kind of is a little schedule, but there's a gap in it in my mind, because I want to get pretty defined on how we get going on this project, because we we talked about this, I guess, about a year ago, and obviously we had delays beyond our control. But where it says notice to proceed will be issued within 3 weeks of city council award. So that's tonight, right? City
Correct.
council award is tonight?
Correct. We're going to be awarding tonight, Jonathan Cook, Parks and Recreation. And we are working with purchasing and the contractor. Notice to proceed. What's going to take place is there's going to be a good bit of site work and examination that has to take place given the historical nature of the structure. And then you have the mobilization factor. So we've been in work, and we really believe by the start of or middle of the summer is when we're going to see actual equipment on the ground, blocking off the bridge, and just that time it's going to take to get mobilized. From there, you're going to see a pretty extensive project. There will be certain phases, but you can count on a pretty much complete closure of the bridge and the Riverwalk areas for a time frame of 18 to 24 months.
Okay. So just so I know, the first one is tonight, so it's going to happen tonight. Item number 2, work will begin on site within 90 days of contract award. What is contract award? Is tonight's action awarding the contract?
Tonight it is awarding the contract from my understanding, and from there they'll have 90 days to really get in there, and then they'll start with the analysis of the site and the mobilization.
Okay. So we'll have it it'll probably be closed starting in June, July.
Yes, we are looking, and we're looking at several factors in June. Obviously, it's a public area, and so we think by the middle of the summer is when we'll see that closure of the bridge.
Okay. 150th year of the suspension bridge. I'm glad we're moving to get the improvements done in this kind of landmark year here.
Correct.
I appreciate your work on it, Jonathan.
Thank you.
Jonathan, when you're talking about closing the Riverwalk, you're talking about the Riverwalk underneath the suspension bridge on both sides. It wouldn't affect the sidewalk areas on each side, would it, or do you think it will?
Correct. At this point, it's still a little bit unknown, but when I say that, I do mean immediately underneath the suspension bridge. Obviously, there are access points on both sides, and what we will come with is directional signage. You will still be able to cross the bridge via Washington. Also, Franklin has
Across the river, not the
Yeah,
bridge.
across the river, yes.
Okay.
And so you can cross right there, and we will have alternative routes in place, but there will be a safety zone underneath that bridge as they are working on the decking and the cables, and that'll be a safety area.
Okay, thank you for that clarification.
And as we proceed in the rehabilitation, events that transpire and that are happening at or on the bridge or have happened on the bridge in the past will be transitioned or shifted to Washington Street Bridge, I assume?
Yes, that is a great option that we have. Take examples, a lot of our runs, like sort of that picturesque finish across the bridge. We're going to be transferring those over to the Washington Bridge, still being able to keep a lane of access on Franklin. And another good thing about the project that we're going to be working on, while the bridge is open, we still have the green space at Indian Spring Park to where we have a lot of our gatherings. We place tents. The street in front will not be impacted, so we'll be able to close the street for street festivals.
Okay.
So we really think we're going to be able to minimize the impact on the events and still proceed as normal once we get to that point.
Okay, thank you.
One other thing, Jonathan, as we talk about Washington, I'm a big fan of all the history of the bridges that we have here, and Washington Street has a lot of unique, in ways it's actually older than our suspension bridge from an original construction standpoint. And it's got some other history that I think it would be cool for directing people over there to kind of highlight that in some sort of signage or something, even though it's only a temporary deal.
Yeah, that's definitely, there is a historical nature, and you even have the old pillars in the interurban railway that went across. And so that's definitely an opportunity that we have. There's some historical markers on that Washington Street Bridge, and something that we can look at.
Cool.
Any other questions? Really appreciate you and your team's work on trying to figure out how to make this work in a way that takes care of the bridge and also takes care of our people at the same time. Thank you.
Thanks for the support. Thank y'all.
Thank you, Jonathan. Resolution 2020-193 approves a contract with Mullen and Lonergan Associates for the completion of a strategic housing plan in an amount not to exceed $85,000.
Just a quick comment on that, and we've never done a study like this before, right? I think it's so worthwhile that we do it the timing is great on trying to figure out how we maximize, quality, affordable housing. And I just want to make sure, are we piggybacking off of something we did 10 years ago, or this is the first time we've done it?
This would be the first time we've done it, aside from the consolidated.
Gotcha, thanks. Looking forward to seeing this report.
If we did one in the past, it's been a long time.
Before you came on
Right,
board?
yeah. I do not remember one. I do not remember one. Next resolution confirms the appointment of Gregory Summers as Fire Chief, City of Waco. Resolution 2020-201 approves agreements with Union Pacific Railroad Company, providing for the construction of needed improvements at 4th and 5th Street to establish and enact a quiet zone. We have a presentation that you also got this afternoon on this that talks about all the intersections between Peach and 13th Street that need work done. This only authorizes us to enter into the agreement with Union Pacific to provide the dollars for the 4th and 5th Street improvements. And we'll be coming back to you with a presentation that will talk about the improvements at the other intersections that are necessary and what those costs will be.
City Manager Stem, let me go back just one second. When you were highlighting 193, I did have a question. So will this study be completed in time that it can be serve as a resource data information for the economic development plan that we're working on?
The Strategic Economic Development Plan.
Yes, sir.
To ask Assistant City Manager Deidre Emerson or Galen, no.
So we are working to make sure that the timing is consistent on both of those plans, and so that one isn't done without consideration for the other.
Awesome, thank you.
Because it said it's November 30th, which is not before our budget, but yeah, that sounds good.
Resolution 2020-208 awards contract to Jack Rouse Associates for Comprehensive Planning Services, Texas Ranger Hall of Fame and Museum. And the resolution.
Which we're talking about the Texas Museum one. I do see Mr. Byron Johnson back there today. Thank you for coming. I know that we're presenting you with all kinds of challenges here, not just the I-35 construction, but now we've got the, some other stuff coming up here, as you've heard today. But I appreciate your work in keeping the Ranger Museum as the quality museum. And we'll try to stop throwing challenges at you here pretty soon and let you get back to work.
Thank you, Councilmember. Resolution 2020-211 awards a contract with Partners for engineering services on Chapel Road water line. The reason I wanted to touch on this one is because at a few meetings ago, the council authorized us to accept maintenance on Chapel Road from, I think from Ritchie all the way to Farm Miller. Once the county reconstructs it, this water line is a critical part of that partnership with McLennan County so that they will rebuild and widen Chapel Road, and we will place a new water line in it to provide additional services to the growing Highway 84 corridor. But we were very successful in working a good arrangements with the county so that we maximize the benefit of this project. There's one ordinance today, and it's the second reading, but I did want to come back to the agenda item that I almost mentioned earlier, which was the item about impact fees and the assessment there. Clint, could you, when you cover your public hearings, could you talk about that one? Okay, I wanted to make sure that the council's aware of what we're doing there so we can move that process forward. And with that, unless you have any questions, that concludes my report.
I just had a quick comment on a couple other resolutions. Number
Okay.
203, where it's great that we're getting that traffic signal put in at 19th and Lakeshore and using only 10% of city funds to get that done. I think it needs some updating there and making it ADA compliant and also getting that traffic signal kind of up to speed, I think is great. And then the other one, I just wanted to comment that 3 resolutions today are acknowledging that we've had bids or projects come in under budget. And I just think that's great that our contractors are working efficiently, and as we ask our staff and our city to run efficiently, and these contractors are also working efficiently, I just want to point out that we appreciate that and the savings that come along with that.
Thank you.
All right, are there any items council would like to remove from the consent agenda? I would like to pull Resolution 2020-195 so that we can vote on that separately. That's the appointment of Chief Summers as the new fire chief. I'd like to be able to recognize him tonight at the meeting. So we'll pull that one, and the consent agenda then will include Resolutions 2020-186 through 2020-211, with the exception of 2020-195, unless a visitor card is received on one or more consent agenda items. And I will ask Wiley to introduce the next work session presentation.
Okay, we have a report from Waco McLennan County Health District staff on update on the coronavirus. So we have Dr. Brenda Gray here and our epidemiologist, Vedihi Shah.
Do we want to start with that, or do we want to start with Clint?
Stuff first?
Well,
Okay, it sounds like you got it.
right.
My apologies.
It was my understanding y'all wanted to start with the coronavirus, so I told Clint he'd be last.
No, that's perfect.
He's used to being first, but he's going to be last. I've already introduced y'all, so welcome, ladies.
Good afternoon. So I want to thank Mayor Deaver and City Manager Wiley Stem and Assistant City Manager Deidre Emerson, as well as Councilman John Kennard for their leadership. Thank you. For their leadership and support of the Public Health District. And so this afternoon, we want to talk a little bit about the Waco McLennan County Public Health District's preparedness response. And I want to start, if you can change the slide too, Larry, or I can change it here, okay? Is this the right way? Okay, yes. So I want to start by talking about, what we, how do we begin to respond to this crisis that our country and our state and our county is experiencing. So although we've been engaged since the early part of January in our build up to readiness, as of 2/26, when the CDC made its formal announcement about the impact this virus was having on the United States, it really allowed our core preparedness team to move to the next level of readiness and preparedness. So one of the first things we did was to establish and convene the McLennan County Leadership Response Team. And this team includes representatives from the city, which include Mayor Deaver, City Manager Wiley Stem, ACM Deidre Emerson, and Councilman John Kennard. From the Family Health Center, representatives include Dr. Jackson Griggs, Dr. Ben Wilson, and Dr. Kelly Reynolds. From Ascension Providence, representatives include Dr. Richard Haskett, Dr. Brian Becker. From Baylor Scott and White, Dr. Jim Morrison, and from Premier ER, Paul Hamilton. So the purpose of this team really was to provide a forum for public health and the healthcare ecosystem leaders to gather to talk about how we would do updates, look at challenges and strategies to collectively combat COVID-19, and also to provide a strategic public communications messaging. A second part of this team is the core public health response team, which includes Margaret Coward, who's our public health nursing manager, Vedihi Shah, our senior lead epidemiologist, Angela Cullivan, Stephanie Alvey, Courtney Woolard, Lacey Sanders, Brianna Proctor, and we've also, at this point, engaged our health educators, our graduate assistants from Baylor, and a number of our other team within the health district to help us with the response. And our third part of this team, or part of the public health response, is the McLennan County Local Response Team. And that is what we're calling our second-tier trusted leaders across the county. They are to support the planning and implementation of actions that we agree upon from the leadership response team, and they convene monthly or as the situation warrants. Since the beginning of this year, the core public health preparedness team has engaged in a continual build-up to increase the state of readiness. We participate in daily calls from the CDC, DSHS, and other pertinent sources. We are interpreting information and guidance and attending various community partners meetings to provide information for many of our partners. We're implementing just-in-time training. We're responding to the 24/7 infectious disease line and the general public health line from 8 to 5, Monday through Friday. So that triumvirate of the public health, city leadership, and the healthcare ecosystem was really the public health district initial response to the CDC's announcement of the COVID virus, landing effectively in the United States. One of the things I think is very important is for us to understand how these activities of local public health departments, and particularly the Waco McLennan County Public Department, can help us in addressing this tremendous, helping us impact the tremendous cost to health and the safety of our public. One of the things we talked about earlier this morning in the press conference was, and I think many of you are familiar with what we call flattening the curve. And if you will view the slide that's on the screen, you'll see that the slide that's the highest, which indicates the number of cases, is when we do nothing about do we have no mitigation factors. And part of that mitigation factors is the work of the public health district and the public health infrastructure across the United States. So without that, we have a very high curve that really exceeds the capacity of our health system in terms of ER, ICU beds, and even our primary care. But with those control measures in place, and one of the things that we are very grateful for the mayor and the city leadership is the control order they put in place to help us expand our mission of the health district to protect and promote health and wellness in our community. Those measures significantly slow down the infectious ability of the virus to be spread across our community. And so our goal is to really flatten that curve so that where that dotted line is, we see where that's the capacity of our healthcare system. And if we can keep the cases below that, then we'll have an ability to serve the citizens of our county in the most efficient and effective way so that we can ensure people's health and vitality. So what I want to do now is I'm going to ask Stephanie to step up here. Actually, I'm going to turn it over to Betty to talk a little bit. Well, I think the core preparedness team, Betty should be next, but I'll let Stephanie come and sit in my place so Betty can stay here. Yeah. I think we got the order a little bit mixed up, but Stephanie's going to come and talk about some of the, a little bit of, not too much in the weeds, but a little bit about what some of those other details that our core preparedness response team within the health district is doing to containment and mitigation of COVID-19. And then I'll return back.
Good afternoon. My name is Stephanie Alvey. I'm the Public Health Emergency Preparedness Coordinator for Waco McLennan County Public Health District. So as that title implies, we do plan and prepare for public health emergencies on a regular basis. I've been with the health district for about 7 years. So some of what we've done, as Dr. Gray mentioned, we have established this core preparedness response team, and we have been meeting since the end of January, mid to end of January, regularly, consistently, every day, whether there was a lot to talk about or whether there wasn't a lot to talk about. But one of the things that we recognized pretty early on is that the guidance was changing daily almost and sometimes from the morning to the afternoon it would be different, and so it was really a challenge to try to figure out or try to keep up with that sometimes. And so what we did pretty early on is establish certain types of guidelines that would affect different groups and assign different individuals within the health district to monitor that so that we could keep up with the changing guidelines and make sure that we were trying to push out the most up-to-date and accurate guidance as we could. Additionally, another thing that we really recognized was that communication was going to be key. There was already a lot of misinformation early on, and so making sure that we became that trusted source of information. We really identified all of the audiences that we really wanted to hit with accurate information, keep them updated on the situation, both at the national level, but also at the local level, and just establish that line of communication with them. And so what we did was we separated that out, those lists out, and we assigned different staff members to make sure that they were providing that information to these individuals on a regular basis. So just to make sure that they had a connection to the health district. that we were communicating effectively and consistently with the most accurate information available to us. And so those are just a couple of the things that we've established through these daily meetings and other operational considerations that we've put into place, so.
Good afternoon, everyone. I will be talking some numbers, give you some statistics on what's going on worldwide, and then bring it down to McLennan County. Right now, as of 1 p.m. today, we have about 190,000 cases, confirmed cases around the world, about 7,500 deaths, and out of those 190,000, 80,000 have recovered. So right now we have approximately 110,000 active cases around the world. Now I'd like to bring your attention to the graph at the bottom right. The orange line is the number of cases in mainland China. The yellow line is any other locations outside China, the number of cases. And the green line is the total number of recovered cases. So if you see, initially China definitely had a high number of cases, but right now we have more cases outside China than inside China. At the same time, we have a lot of recovered cases as well. So yes, the situation is serious, but we are making some progress as well.
Dr. Shaw, may I ask you a quick question? When you say completely recovered, are you meaning that they once had the virus and no longer have it right now?
They're not symptomatic, so yes.
Okay, thank you.
Now let's move on to the United States. As of today at 1 p.m., in the US, we have 4,226 cases. We have 75 deaths, and 49 states, along with several territories, have reported cases. When you look at the map, we can see that Washington and New York have the highest number of cases, which is followed by California. That's then followed by Florida, Louisiana, and then comes Texas, where we have 51,200 cases right now. I'll go in more details with Texas cases. Again, as of 1 p.m. today, we have 64 cases, confirmed cases in Texas, and 1 death. Most of the cases that we know of are travel related, but we have seen some cases of community transmission in the state. They've been in Montgomery County, which is down south Houston, and Dallas County. I would also like to define community spread. When we say community spread, it means that we are not able to find a cause or etiology of the case. It's not travel related, we have no known exposure. That's when we would say that yes, there is probable community spread. And then moving on to McLennan County, from January 23rd until yesterday, we have tested about 30 individuals in McLennan County, out of which 12 have tested negative and 18 are pending results. The reason why 18, such a high number, is pending because just yesterday we had 13 cases that were being tested. Out of the
Would you say that one more time? How many yesterday?
Yesterday, 13, 1-3.
Thank you.
Out of the 30 tests, 17 were conducted by the public health labs, that is the DSHS lab or the CDC lab, and the remaining 13 were conducted using commercial labs. I just want to talk a little bit more about testing. So until 2 weeks ago, only public health labs like DSHS, the state lab, or CDC were conducting testing. As of last week, we have seen a lot of commercial labs come up, so we will see an increase in testing. And that also makes it difficult for us to have a proper record of or follow patients who are being tested through commercial labs. Right now, there are policies that the state is putting in place so that we get those reports, but we are working as much as we can with our healthcare providers and our labs to get as accurate information as possible. Thank you.
All right, questions Comments from council members?
I'll start off and just say how much I appreciate tackling something so difficult. This is, I think it's the phrase that everyone's saying, and it's an understatement. It's unprecedented and unusual times, and so I appreciate the level of strategy that has gone into this. It's comforting to hear that team listed, that Dr. Gray listed at the beginning of this, the names and titles of the members of the response team that are regularly collaborating to make sure that we're prepared for this. We've got a great community of healthcare professionals that I think are really helping our community navigate this difficult situation. So I appreciate this. Mayor, a question I would have for you is this a time, some of our questions are related in general to the city's response to this and not specific to the presentation on the healthcare side of things. Is this an appropriate time to engage in those discussions?
I think so. Why don't we talk first about the presentation and any questions directly about that, and then let's discuss city's response and what we have going forward.
Great. One question I have is people have asked if playground equipment is safe in parks. And so I don't know if that's something you would want to comment on. And some of these questions, I know this is evolving, so feel free to just say, hey, I'll get back to you with that. That's fine. I don't want to put you on the spot here, but that's something that I've got some questions about is some families, not just mine, are going stir crazy. The question is it safe to go to playgrounds?
Well, I do think questions like this, just before y'all answer that, are important as we develop our fact sheet and are being more upfront in our communications, just to help the public feel safe about what is, and where the risks kind of lie. So I appreciate y'all answering all of these.
And the fact that we'll be taking a lot of these questions directly to our leadership response team tomorrow at their weekly meeting. So I think if we could compile a list of these questions, that would be great. If you all have an answer, that's great. If not, we can take it to the leadership.
So just briefly, when we look at CDC guidelines about mass gatherings, if you're at a community park, and part of the, message I think that we're missing is we want people to do the social distancing. So sometimes parks are not crowded, sometimes they are, but it's important that our children have activity. And so I think, based on CDC guidance, we do have to have wisdom in, getting outside and getting fresh air. But I think part of the mitigation strategy is ensure that and it's difficult for young children to not touch their faces and make sure their hands are clean. And so that, as a parent, as a grandparent, we've grappled with that question with my 3.5-year-old granddaughter and my 5-month-old granddaughter. And we have erred on the side of allowing them to go to the parks, but, taking our own cleaning supplies and wiping those things down and then washing their hands regularly. So that is a personal thing that I'm doing, but we are reviewing CDC guidelines around those types of things, and Deidre's asked us to respond as quickly as we can. So we have a number of questions that we are still, looking at the guidance and then deciding how we put it in layman terms so that we can have it for public consumption.
My next question is there anything that we can be doing, city specifically, or the community at large, stakeholders in the community at large can be doing to be advocating or getting more testing kits? Or do you feel like that is a need even? Maybe the first question is whether or not there's a need for more.
Well, I think one of the first things that Mayor Deaver and the council has done is have the declaration order in place, and that allows us to trigger other levers for us to get the assistance and support that we need. So I think we've done the first step, and then I think the follow-up communication ensues after that to advocate for the services and products that we need for our citizens.
One thing that I heard this morning at the press conference was about where to get, if you feel like you need a test or are experiencing symptoms, to go to your healthcare provider, not go to the emergency room. So I just think that this is a good opportunity to reiterate that. Would y'all agree with that as well?
Well, absolutely. I think one step back further is Dr. Griggs is advocating that go to the website first, because sometimes there's assessments there, because there is an inundation of phone calls, and my team at the health district can attest to that. If you cannot get the information that you need, then call a provider and allow that provider to give you instructions about how to access the healthcare system, whether it's through a private clinic or through the emergency room. But that's definitely based on the severity of the symptoms and that person's practitioner. And if they don't have a physician, they can use the 211 to call to get that referral to that resource that they're needing.
And that website for the Family Health Center is wacofhc.org, I believe, and should have kind of a
And I
flow
think
chart.
each of the systems have their own website to connect with. So that is Family Health Center, and then we have Baylor, Scott and White, and of course Ascension Providence and the Premier Emergency Room. I believe each of those partners in our leadership response team have information on their websites to connect people to the resources that they need to get connected to the right care at the right time at the right place.
I think, and the last question I would have for you, Dr. Gray, is I know that there's a lot of community organizations and churches who are eager to volunteer. I know there's a lot of different needs, but is there any needs that you're seeing from your vantage point, or any direction that you would point mobilized volunteers to go towards?
So I think in the current time right now, we have our initial response team at the health district, and we are naming the secondary response team and a tertiary response team. So we're doing just-in-time trainings to train more staff to help us, particularly around the call piece of it. Mm-hmm. So Stephanie and her team and Margaret are working through those frequently asked questions so that we can have a concerted response to all of those things so the information can be cohesive across the public. And so at this point today, with where we are managing that, but with the inevitable spread, we may have to call in more volunteers. And part of the structure we have in place is, under the operations piece, standing up a volunteer process to have people come and support the work of the health district.
I think that's all the questions I have for y'all. Thank you so much. There's a couple other comments at a higher level I'd like to make. Sure.
Councilmember Meek,
yes.
We will also work with a number of our nonprofit entities throughout the community to make sure that if they have needs, that we will to develop a library of kind of what the needs are and who we can refer them to help with those needs so that we can build the community volunteerism capacity.
Awesome. Thank you so much.
I'd like to add one more thing. There is a vulnerables populations committee that Stephanie leads, and I'm a part of that committee. So we're looking at those communities that are more vulnerable to situations like this, so we can make sure that we have the resources wrapped around them that they need to make sure that they're staying healthy. So we're having that conversation internally, and certainly we'll connect with Deidre's comment around the other resources that we can align to make sure that we're meeting our most vulnerable throughout the county.
Very good. Thank you.
Mm-hmm.
I'll just chime in quickly with Dr. Gray. I appreciate you bringing this team together, and Mayor Deaver and Deidre Emerson, ACM Emerson too. You guys have worked quickly to build a pretty impressive team of medical folks and public officials to sort of respond to this, and so I commend you very quickly putting this together. That's great. And the second thing I want to say is the communication, I think, has been good, very good too, and not just go to the website and figure it all out. I like we were on television this morning and the cameras were there. I think it's important that we show the leadership don't create a panic. We're on top of this, and we're trying to stay ahead of it, and we'll communicate everything we know to the population of Waco as quickly and as efficiently as possible. So I think that is a very important part of what we're doing here. And third, I like the data-driven, those two slides that you had on, here's what's happening, here's the frequency, here's all the data around the COVID virus. I think is important. As long as we keep it data-based, to me, and stay ahead of it and communicate it with an organized team. And that team we had out on the stage this morning was very impressive. Just very impressive to me to have the doctors up there and your leadership and the mayor and the councils behind all this too. So I just wanted to express my appreciation as we go through this all together as a council and as a community. We're going to stay on top of it. We're going to communicate the best we can. Thanks.
Dr. Gray, thank you and your team for your presentation. I only have a few questions. I will proceed those with, again, commendation for our mayor and leadership in getting in front of the messaging today. One of the things that I have been told repeatedly is that, you know, regardless of what's happening in national news, I need to hear from people I know. And it is important that our trusted influencers, you, sir, the mayor, you know, our health district leadership team, Assistant City Manager Emerson, those people who are trusted within our community are getting this message out, so I'm grateful for that. I did want to ask a question. Councilmember Meek mentioned the testing kits, and you said that the declaration would help to trigger other resources. Can you kind of expound on that? Because, you know, the questions I get are, you know, do we have enough tests? And I was like, what does enough mean? You know, I mean, you know, what is, you know, especially since we have had no confirmed cases, does that have an effect on how many are available, where they're available, who get, you know, I mean, those are the questions that I think, if you can address, can speak to, and one of the things that are on the forefront of minds. The other, because I'll talk and then shut up and let you talk. And if you could speak to, the slide is amazing about what flattening the community spread curve looks like, because that's incredibly important. But I would like to see if you could put some little meat behind that, you know, because I know that there are things that are happening within our community. You know, people who died last week weren't planning on this. And so, you know, there are major funeral services that are going to have to be adapted. And I don't know people understand why that is. So if you could kind of address that.
Okay.
For me.
So nationally, we have a commitment from the current administration to ensure that the Roush company and another company I can't think of the name of are producing those kits in masses so that they can be disseminated across the state. So when you have declared a state of emergency, that in itself allows, it's like the greasy wheel gets, the squeaky wheel gets the grease. So it allows people to know that we have declared an emergency, that we need the support from external resources that we don't have. But our healthcare systems have assured us that they have access to testing. Of course, as a public health district, we don't do testing, but we do facilitate the transport of those tests if a doctor or provider uses the health district as that vehicle to do that. In terms of the testing, as time goes on and our internal public health infrastructure as well as our corporate infrastructure catches the demand, the supply catches up with the demand, we'll have more testing. And so that is one of the critical pieces in identifying, you know, how quickly the disease is spreading, so we can be able to increase our mitigation efforts. And so it is a matter of supply and demand, and without us, this is a novel disease that we've had, and so we were, I won't say unprepared, but we were not expecting this. And so it just takes time to ramp up those types of resources. But the order for me allows us to be on record stating that we're going to be very proactive and conscientious about what our community needs are. So here we can log and catalog what we have, and some of the work that Stephanie is doing with a number of the preparedness teams across the county is cataloging what types of resources we have in terms of PPE equipment. And that's very important because we have critical shortages that's being reported to us from that leadership team that is meeting, and we are aware of that. So as resources come, we can stand up and say, here is what we need, without having to go and start that process. So it allows us really to go to the next level of readiness, and that's what's important, because without the order, we were kind of, I would say, stirring at a certain level, waiting for that next shoe to drop. And now, in my mind, the shoe has dropped. As I said, CDC let the cows out the barn with their announcement on February 25th. And so this order allows us to move to the next level of preparedness to address what will unfold in our neighborhood. And in terms of flattening the curve, primarily it is those, CDC said, the non-pharmaceutical interventions and the social distancing. That's the main thing. Washing your hands, cleaning frequently touched surfaces. Those are the types of things that will flatten the curve, and those are the things that we have been advancing in our communications across those sectors and audiences since the very late part of January. So that part of the earlier you do those interventions to mitigate and contain it, the better your outcomes will be and the better our chances flattening that curve so that we don't exceed our healthcare resources and ability to help people who really need help.
Thank you.
Yeah, and that flattening the curve, that, you know, these things, that's why we did what we did today, even though there are currently no cases confirmed here in town. Just the fact that there are just a finite number of hospital beds, finite number of doctors, and finite number of just general resources, tests and others here in our community. And that I think these actions are intended to help, again, as we kind of lessen our contact, we lessen the number of cases and number of potential cases, particularly since this thing can be spread asymptomatically, that happen in our community, and we can slow that rate down to ensure that those that need the help the most get it, which is why one of the other messages, somebody asked me, you know, so what was your kind of take, you know, this morning, you know, during it, you know, the doctor said if you only have mild symptoms, or if you're not, if you're worried, you know, reach out, but don't go to the ER if you think you have it. You'll call your primary care physician first, do that. And that's because there are the potential to completely overwhelm our system is so great at this point, which is why we're taking these measures, that being concerned obviously is incredibly important, but making sure that our resources are there for those that are in the most dire straits and will need it the most. And so you know, I now have, again, flattening the curve, social distancing, and all those are new to my lexicon. But it is, be careful now that people know that. They may use that to me later on in terms of social distancing. That'll be a good excuse. But anyways, I'm just want to reiterate, I'm thankful for the work we're doing. I know that this has kind of caught us all, not off guard, but it is amazing how quickly this has developed over the past few days. And I think I want to laud our response, and again, as we were talking about the questions for our FAQ and the meeting tomorrow of the response team, and kind of where we're going as we continue to going through these big questions about what this is and what we're doing and how that looks. So those smaller questions of, can we go, you know, take our dog for a walk in the park, or can we go to a playground, or can we, you know, what does this look like, you know, in our daily lives over the next couple of weeks? But so I just want to say I appreciate y'all, I appreciate the mayor, I appreciate our other health providers in this council for taking these, what I believe are very important and necessary steps. Take the medicine, not a pun unintended, but take the pain all at once now to lessen and shorten the duration. So otherwise this could extend for a longer period of time. So, so again, based on, if we're talking about just the presentation at the moment, I don't think I have any other additional questions, but I just want to say thank you for the work that y'all are doing right now. Yeah.
So I agree, Dr. Gray. We are so grateful for your team and the great work that you've done and the leadership you've provided. I want to talk about some of the other things that we're going to be doing, part of what we did today, and then the other things we're going to go do going forward. So let's open that part of the conversation up, and I think, Dylan, that you had a couple of things, and then we can go around one more time.
Well, again, first is just to kind of tie off on what John was saying. I was just saying, you know, I think the question that business owners might be asking is why now? Like, why did the order get imposed today? Why did the mayor's order get imposed today? And what I'm hearing from our health district is based on that curve that we saw a few minutes ago, that this could really reduce the spread. These restricting the convening could reduce the spread, save lives, and I think also I am actually in the belief that could hopefully minimize the impact of this virus on our economy. So hopefully now, if we can just hunker down and ride it out more quickly, impacting fewer people, our economy will be more likely to rebound more quickly as well. And to the point of how this virus, and Dr. Gray, correct me if I'm wrong here, does spread without people knowing that they have contracted it yet. So by minimizing people convening, not going to restaurants, not knowing you have it, and then talking to 100 people, spreading it around, hopefully that'll minimize the spread, save lives, and we'll be able to rebound more quickly. That all said, I think it's the right call, but I think that there's an opportunity for us to rise up and support business. I don't think the response is for business to continue as usual, but I do think considering creative ways that we can support business is what we should be talking about. And so a couple of ideas that I had that I'll just throw out there and let sit, and then maybe we can run with it as time goes. And I see Chris Collins here from the Chamber. Thanks for being here today. But I think that it is going to take partnership. So all three chambers in our community, we have three chambers in our community in Waco partnering together, Startup Waco, City Center Waco, other stakeholders like that partnering together and coming to say, hey, how do we support businesses? Saying restaurants are still open. You can't dine in, but they're still open. So let's get a campaign going to get takeouts and a campaign going to go through the drive-through. What does that look like to support those businesses? How do we help businesses adapt to what this order would bring about? And I think that our collaboration with them is important. I think advocating to state and federal leaders for relief. I sent emails to our representation this morning just asking them to please consider relief for a small business. I'm hopeful for that. And then I think exploring things. I saw online that the city of Sacramento set aside some funding to do smallish interest-free loans to small businesses to float them through this time. And I think exploring creative things like that are things we should be talking about. And I don't know if that's right or wrong or what, but I think we need to be exploring that level of creativity in this season. And then last, I think there's a lot of information that other governmental agencies are providing that I think it'd be helpful for us to help distribute as we learn it. I know the IRS is giving tax relief, SBA is doing some different things, unemployment benefits from the Texas Workforce Commission, making sure that we're pushing out that information, I think would be critical. The last thing I'll say is just that as we communicate, I think it's really critical that we're using all opportunities to communicate, using so many different platforms now, but a lot of them are really effective. So Twitter, Instagram, posting in stories, Facebook, posting in stories. The cool thing about those social media platforms is they can be tied together. I think you can do one post and it just blasts out on all platforms. You can sponsor that and it boosts and reaches a wider audience. I think video PSAs and Larry's good work at the Waco City Cable Channel and blasting that out, I think really pushing this so that there is, I think Councilman Bearfield told me the other day, no one is left to wonder, I think is important in this time. So, yeah. That's all I got.
Just to add on to that, I have to agree with Councilmember Meek. I think supporting our local businesses and entrepreneurs is very important today. Even more so now today, I have to agree that, we stand behind our mayor and the leadership of this community to say that this was the right call. I know it was not an easy decision to be made, but we know that it needed to be done. To piggyback on to what Councilmember Meek was saying, even one thing that I'm thinking about is, going back to the health field is, there's a lot of uncertainty and fear and anxiety to a certain point, and how do we connect people with even mental health care professionals, to walk them through this stage, because there's not only a fear physically, but also fear mentally and emotionally. And so, how do we help our constituents and the community members go through that process and walk through this process while still feeling safe, not only physically, but in their mind and their emotions as well. And so I think for us to think about those resources that we can offer as a community, as a city, that is very important, that makes a person the whole person, mind, will, and emotions. And so I think it's very important that we are also looking for creative ways in offering those services to our community and city members. So, but overall, I have to say, I'm very proud of our leadership, our city staff, our city manager's office, and just all the work that's being done. I know that has snowballed a lot quicker than we anticipated or expected. Mm-hmm. But however, we are here, and here's an opportunity for us to really move forward. And I agree, nip it in the bud now before it gets larger. And I know it's it could be an inconvenience, and sometimes it will hurt businesses and even us community members. But I think someone in the press release said earlier, let's show people the Waco that we really are. And so I think here's an opportunity. And so thank you for everything that's being done so far.
In regard to businesses, I know that, sir, this decision was not made lightly. I know many hours were spent up on the third floor trying to get this thing together. I want our business owners to know that we did take into concession everything that you stand to lose. Yet we do have this opportunity to save lives. And I know it may sound extreme and it may sound dramatic, but that's the only lens that we can look at right now. I don't think that there's a sacrifice that we could afford to make. Now, I think we have opportunity in galvanizing our chambers of commerce to create a wraparound services, if you will, for these businesses. And, I posted on Facebook today. I said, okay, so I ordered takeout from a local business. This is to pick up. This is my new normal. Okay. And we encourage people to do that. And we encourage our chambers to work together to do that. We're going to have to use our social distancing to build community. But we are Waco, and that's what Wacoans do. So I have no doubt that it can be done and will be done, because we don't know what this looks like. This is an incredibly uncertain time. We are literally fixing this plane as we fly it. So, we all just need to figure out what wrench we need and get to work. I will ask one other question. The daycares are not really, they're not in the order. And I want to make sure, are there any regulations that are heightened requirements dealing with the daycares? Because I know people aren't working, so there's all these things going on about what do I do with my kids, if they're young, school, babies, and they do go to daycare, they can still go, correct? And, are there any other safety precautions that have been put in place because of that?
Jennifer, do you want to speak to the daycare issue?
So, under the mayor's order,
I don't think you're on.
childcare facilities, not on?
I don't think you're on. Yep.
Under the mayor's order, child care facilities are specifically exempted from the definition of community gatherings. And, but for all those listed of exempted businesses, they still must maintain to the extent possible the 6-foot distancing for other than short periods of time. Sure. And so practically speaking, how does that work in a daycare? That may be more of a question for the health district, but they are specifically exempted from this order.
I know I had seen some things where, the workers will come out to the car to receive the children and that kind of.
They're testing the children so they don't have fevers.
Yes,
and enhancing their cleaning. Well, they're already doing the cleaning practice, but enhancing those things with the hand sanitizers and the spraying. So my grandchildren's daycare are one of those daycare that you can drop them off and they check for fevers, and then they're doing the enhanced cleaning that CDC is recommending.
Very good. Thank you.
Well, I want to say how much I appreciate council's support and all the input that we received, both me and the city manager and legal team, as we tried to craft this emergency order today. It was something that I never thought as mayor would be something that would be on the agenda. But it did become necessary, and in my view and in the view of our public health officials, which was the thing that was the driving force. I am not a public health official, and none of us on the council are. But it's our job to assemble the best people we have in our community to give us the best advice they can about where we are every day of this coronavirus pandemic. And we're doing that, and it became obvious yesterday through the course of the day that it was time to do this. It is true that we still have no confirmed cases in McLennan County. I will tell you that I expect that we will have confirmed cases very soon. and that they were going to begin spreading pretty quickly. And that is based on input from the health professionals. So that's why we felt it was so necessary to take this action. And it was, as has been discussed up here many times, not taken lightly. We recognize that this is very difficult for businesses. It's very difficult for employees. Food service employees are some of the most vulnerable employees in our city. It also impacts, as Andre has said, things like funerals, things like weddings. So these are big things in people's lives, and we don't take it lightly. But we have one overriding goal here, and that is to try to protect the people of Waco and McLennan County from the worst outcome that could happen here.
Right.
And so that's the great work that our public health people are doing. I'm so grateful for you, Dr. Gray, for your staff. Deidre has done a great job in her role. John Kennard is chair of the Health District Board, and our entire staff here at the city has just done a great job in getting this forward. I know it's not something that people are excited about. It is going to be very difficult, and we got to help them find, as we've been discussing up here, ways to move forward and minimize the economic impact of this. So I appreciate all of your support, and thank you all for being here today.
Thank you.
One more quick question.
As we work through this over the last week, these things have changed pretty rapidly. I know I speak for our city attorney's office, Jennifer, and our city secretary, Esmeralda, and all the city manager's office staff and all the folks that have engaged, how much we really appreciate the thoughtful leadership and support we've received from you and the council. It's made a huge difference for us as we engage the staff, the challenges the city will face, but there's never any doubt about where our council's coming from and how much they support us, and we really do appreciate that.
Thank you, Ollie.
Echo all that. A quick last question. I know we had talked about the willingness and the work that our nonprofits and our faith groups and everyone are already kind of working on to help address the hardships that are going to be going on over the next few weeks to month. Is there anybody? And we said we were going to be working on that. Is anyone coordinating that specifically? Have we tasked? Who should? I mean, if someone who's tasked with making sure those efforts are being coordinated, and if somebody does have a need that is identified, that we can help funnel them to the right facility. I mean, I think it would be important. I mean, happy to help, to just have a group that can be identified of 3 or 4 that know what's going on to help coordinate and identify and move these efforts forward in a meaningful way, just as we're, for our, helping our businesses as well, but also our most vulnerable populations. And you said we had that vulnerable committee. I mean, I just want to know, I want to make sure that we can get out publicly who the contact is if somebody A, has a need, or B, has resources that they want to share and want to meet a need.
So we have a meeting with Baylor, Dr. Yancey, and she leads a group of about 200 faith-based community members. And so I'll be sharing with them pretty much the presentation we have today and asking them for their support as we ramp up our readiness for COVID-19. But how they will engage at this point, I don't know. So that's an opportunity for us to have that question presented to them, because with their mission as a faith-based community, they will likely find ways to step into that void and help us with this. But I can't answer the question today, but it certainly will be something that we're having conversations about.
So I think that's also a question we can deal with at the
tomorrow
leadership meeting tomorrow.
Yeah, let's just.
And I failed to say, following that leadership meeting, we're going to start sending out regular social media blasts, letting people know what is coming out, getting people the latest information as far as local response and local needs and local recommendations for Waco and McLennan County. This group of the McLennan County Leadership Response Team meets every Wednesday. And so following that meeting, we expect to start having some press conferences. We won't have one tomorrow. We will probably have them on a regular basis going forward as well to give people updates on what's happening on a weekly basis here in McLennan County.
Sure.
Go. All right.
I had one more quick question about operations. Our municipal court, have we thought through that, just tickets, trials, standing in line, all those things?
So I'm not sure if that's.
Thanks, Dr. Gray. We have a number of impacts that have been thought through in every city department, as you might imagine. including municipal court. We'd be happy to provide an IR to the council documenting the great work, frankly, that's been going on behind the scenes of all of our city staff to ensure we can continue delivering adequate service to all the Wacoans.
And I think it'll probably be a ditto for an answer, but I know that one of the concerns that I've heard from members of the development community is inspectors not being able to inspect. And so this might transcend to multiple departments, but I know that whether, thinking through if employees are not participating in regular functions, are there third-party contractors or other creative solutions that we could look into? So just throwing that out there, I think, again, probably the same response, but.
That's part of the discussions we've had also, because we do understand how important it is to keep our contractors engaged, the building projects that are going on, because, well, we certainly don't need those to grind to a halt. And I think there's going to be some challenges with the amount of work that we're going to have to distribute to our inspector group, but we're going to try to work through that. And that's part of what we're working through with these continuing operations plans. Our Assistant City Manager, Ryan Holt's heading that up, and we're working through all the departments on that. That's certainly one of the considerations.
Well, I can't say enough how much I appreciate y'all's hard work on this.
I just wanted one last comment, that most of the calls and emails I've gotten over the last couple of days, I think more than half, have been from citizens asking, how can I help? I mean, what can I do? Particularly for the older, and I think, John, you touched on a little bit on the more susceptible people, the older folks, and Meals on Wheels kind of folks. And then I hope over the next few days we can come up with some solutions and some guidance on how do we tell the citizens if to be part of the solution here, which again, it makes me confident in the human condition. We have great Wacoans that want to step up, which it doesn't surprise me at all. But as we kind of formulate thoughts on how to organize that or give people advice on how to help, I think that's important as well.
Great. All right. Thank you all. Thank you all very much. We appreciate you being here today.
Mayor and Council, now we'll hear from our Director of Planning and Inspection, Clint Peters, on the planning public hearing agenda item.
All right, we do have 11 public hearings tonight. The first one being for our subdivision plats, which we have 4 plats. The first plat is the preliminary plat of the Springs Edition. This is a plat, land planning for a new subdivision in our ETJ along the Highway 84 corridor near Cotton Belt Parkway. It's 122 acres, planned for 303 lots, which is about 2.5 units an acre. This property is in our ETJ, will be county maintained road system that accesses Highway 84 and Cotton Belt Parkway, which are TxDOT roadways. But the utilities, water and sewer, are provided by the city of Waco. Here's the layout of it. Again, single family. There is a large drainage area through the property that they are maintaining the floodplain. Part of this preliminary plat process did require a traffic impact study that was submitted and reviewed by TxDOT, since they are accessing TxDOT roadways and has been accepted and approved by them. They also provided a drainage study that meets all our stormwater guidelines, and then also a water capacity study for the impact on our water system. And that has been approved by our utilities department. They will be extending a new main through the property that is identified in our master plan that will eventually help the city loop the system to provide adequate capacity in that area. All the comments have been addressed, and Plan Commission recommended approval on this one. The next plat is the preliminary plat of the New Road Development Edition. This is a commercial preliminary plat on New Road, 3 lots, being platted out of 10 acres adjacent to the existing Flying J development truck stop and the new Quest development where it has the entertainment uses there. This is planned commercial. They are proposing 3 lots. One is being proposed for self-storage on Lot 2. There are sidewalk requirements and some sewer line extensions to serve this property. And then if any of the uses end up being high traffic generators, there will be some traffic impact analysis requirements at time of development. They have met all the comments on this one, and Plan Commission recommended approval of it as well. And then the last 2 plats are in our final plats in our South Fork Edition, which is a single-family residential development out on Loop 340 near Orchard Lane. First is the final plat of South Fork Edition Phase 20. This is a small 3-acre final plat that includes 17 lots. 2 of those lots are for drainage, so 15 residential lots on 3 acres. The infrastructure plans have already been approved. This is just the next phase of that single-family residential development that's been developing out for the past 8 years. And then the last plat is the final plat of South Fork Edition, Phase 23. This is a single lot, Lot 2, Block 19, that is a drainage and utility lot that will be part of the infrastructure that connects to Loop 340 for drainage purposes and utility purposes. There will be no residential structures on this lot. And both of these are also recommended for approval by the Plan Commission. The next public hearing, 176, is a short-term rental type 2 at 3425 Pewitt Drive. This is in our Alta Vista Neighborhood Association along Pewitt Drive in between Robinson Drive and Old Robinson Drive, a single-family home. The owner lives in the home but proposes to rent out occasionally when they're out of town. They do have an operator. There is a 3-bedroom home. There does have parking, but it is substandard, so they're going to have to upgrade that to meet our standards for parking lot. They'll have to put some concrete borders along the gravel parking lot. No opposition on this one, and Plan Commission recommended approval.
Clint, did you say that they will have to upgrade their driveway before the permit is granted?
Yes, sir. Our driveway standards for residential, you can have either asphalt or concrete, or you can also have gravel, but if you have gravel, you have to border it by concrete to keep that gravel in place.
Thank you.
You said Plan Commission recommended approval?
Yes, on this one. On the next case, 177, is one that they recommended disapproval on.
Gotcha.
So the next case is 177. This is 3107 Lasker Avenue. Back Arrow Investments are the applicant for a short-term rental type 2 in R1B zoning district. This is in the Dean Highland Neighborhood Association near Highland Baptist Church and the Dean Highland Elementary School. Newly renovated single-family home, 3-bedroom. The owners do live outside of Waco, stay in the home when they visit here, would like to rent it out for a short-term rental. They do propose to have a local manager. There was opposition on this one. A group had come to oppose a similar case, public hearing 180, which is on Maple, which is near this one, and so they also opposed this one as well. None of that opposition was in the 200 feet, and we did not receive any responses back from the notices within the 200 feet, but the group that was at Maple also opposed this one, like I said. The Plan Commission did recommend disapproval of this case 7-1, which does trigger the supermajority requirement for approval for City Council. The applicant was out of town this week and has requested a continuance to the next meeting to allow them to be able to attend the public hearing. Here's the house. It recently was painted. They're still renovating it, but it's close to being finished.
Yeah, and on this one, Clint, you sent all those notices, none of them were returned. And also somebody, as I understand it, somebody actually appeared at the Plan Commission in support of, or I guess general ambivalence to whether a true neighbor came in that was right next door, I believe, supported the.
That's
Yes,
correct,
sir.
yes, I failed to mention that. There was one neighbor that came to the hearing, and once they understood what's happening, they were in support of the request. That
So
was within the 200 feet.
And the opposition that was there was not within 200 feet or on 20%. They were not a part of the immediate neighborhood.
They were not within the 200 feet.
Correct.
Yes.
Okay.
This is, and I can show it on this map, but, so here's the case on Public Hearing 177 here. And then Maple up here is where the case 180 is. So it's just 2 blocks away. So I mean, they are in the same, what I would consider neighborhood, but the opposition for 180 was not within the 200 feet of 177.
The one in I'm sorry, the one in Maple clearly was within the 200 feet, 20%.
That's correct.
In fact, it was way over 20%.
That's correct.
As we'll look at here in a couple. But this one did not have any opposition within the immediate neighborhood. And in fact, there was somebody in support of it in the neighborhood.
That's correct.
All right.
And just to clarify, Clint, and correct me if I'm wrong, the 2 houses that are on the agenda for public hearings, they are not within 500 feet of each other, correct?
That's correct.
Okay.
Yes. And staff is supportive of the continuance to allow the applicant to be here for the hearing. The next public hearing, 178, is a request from 1923 Austin Avenue LLC for a short-term rental type 3 in O2 zoning at property located at 1920 Washington Avenue. This is a short-term rental 3 is for apartment complexes. This is the new Carriage House Flats apartments along Washington and the Austin Avenue Neighborhood Association between 18th and 23rd Street. They are requesting to rent out one of the one-bedroom units that's managed by a real estate management company. We did mail out 27 notices. We did have 3 with some concerns, but we didn't put that down as opposition. And the Plan Commission did recommend approval of this one, 8-0. The next short-term rental is at 2400 Ethel Avenue. This is in the Sanger Heights Neighborhood Association. Request from Deanna Baxley. This is another type 2, 3-bedroom house, rent out the whole house. The owner does live in Waco and will lives in the home when they're visiting Waco and would rent it out and have a local manager. This is in the Sanger Heights neighborhood, single-family house. They have the appropriate parking there. We did get 2 cards in favor of this and no opposition, and Plan Commission recommended approval of it. So the public hearing 180, this is the other one that was recommended for disapproval at 3015 Maple Avenue for a short-term rental type 2. This is along Maple Avenue between 30th and 31st Street, 3-bedroom home that's being renovated currently. The owner's daughter does live in the home when she is in Waco, but she travels a lot for work, and they wanted to have the opportunity to rent it out when she was out of town for work. It will be managed by a local management company. We did get 1 in favor on this one, 5 in opposition, an email in opposition, and then we also received a petition with 8 of the 11 property owners within the 200 feet that were opposed to it. So, and about 10 people were here present for the Plan Commission meeting and spoke opposed to it. So it did, Plan Commission did recommend disapproval of this one. So with the 20% and the Plan Commission vote, it did trigger it with both those qualifications for a supermajority vote for council. This is the house here. It's directly across from Highland Baptist Church, Maple, across from there. And the next short-term rental is a short-term rental this is a special permit for a vet clinic, boarding and a crematorium for an R1B and C3 zoning for a property at 4900 Steinbeck Bend. This is a vet clinic that's been in operation since 1995 with a special permit from Dr. Luann Irvin. She has recently retired and has a property under contract to Dr. Aaron Lyde, who's requesting to have that permit transferred over to him. The facility is already in place. There'll be no changes to it other than signage and small minor changes to update the new owner. Plan Commission recommends approval of this, and there was no opposition on this one. So public hearing 182, I don't have any slides for that. This is the public hearing for the impact fees. This is to consider the city's land use assumptions and capital improvements plan associated with the creation of impact fees for water, wastewater, and roadway capital improvements. There is no action required on this public hearing. This is, we're finishing up, we've been working with Freese and Nichols here as a consultant with this. We're finishing up the last steps of phase 1 of the impact fee study that includes providing a land use assumptions, which is basically our growth, how the city's going to grow over the next 10 years and where that growth is occurring, and then creating a CIP for infrastructure that's needed for that growth. Just a little refresher on impact fees. Impact fees are used to offset some of the capital costs for infrastructure needed for growth in our areas that don't have the infrastructure currently to accommodate that growth. And so we've been working with Freese and Nichols over the last year, meeting with our Capital Improvement Advisory Committee, which is made up of our Plan Commission, and then 4 members of the development community, which include Scott Bland, Ken Cooper, Herb Cross, and David Mercer. They have met 3 times to go over these land use assumptions and CIP. They have taken action to recommend approval of them. We've also had several meetings with our developer stakeholders group, one in December, one in January, to talk about these, to get information out. Like I said, this is the final step of phase 1. We had the public hearing tonight, no action tonight, and then we'll have a resolution on your next council meeting for action to approve the land use assumption and capital improvement plan for the water, wastewater, and roadway impact fees. That will let us move over into step 2 of the process, which will be to calculate the fees and then ultimately discuss potentially adopting a impact fee ordinance. The impact fee calculations is a pretty vigorous process that Freese and Nichols will provide the city the maximum fees that you can charge for each of those areas, water, wastewater, and street. And then there will be a lot of policy discussion that will need to be had with our stakeholders, staff, and city council on what those fees should be. That process, once the LUA and the CIP is approved, will be roughly about a 3-month process, and then there'll in the summer, we'll work again with our advisory committee, have public meetings with our stakeholders with the goal of having the ordinance out for adoption, review and adoption in late summer, August time period. We are following all the requirements of Chapter 395, the Texas Local Government Code, that requires that this report for the land use assumption and capital improvement has been advertised for 30 days. It's been on our website. We've had copies at the city secretary's office and the library. At our planning office, we've sent out copies to our stakeholders. And like I said, we've had several presentations with our stakeholders as well, that Freese and Nichols, and I believe y'all were provided with the presentation that Freese and Nichols was going to give at the work session that was canceled. I think that covers that. Are there any questions on this process of where we are on it. I think a lot of the discussion and is going to happen in phase 2 when we actually know what the fees could be, and then start talking about policy decisions about adopting those fees, where they apply. You know, water and wastewater can be for citywide, including ETJ, where roadway are in certain areas that can't be more than 6 miles, service areas that have been identified, so there'll be different discussions on those. But that's a recap of where we are on the impact fee study, and then the public hearing that we'll have tonight.
Yeah, Clint, I'll agree with you that I think this is going to be an active issue over the course of the summer and fall as we figure out how we're going to if and how we implement the impact fees. But I just want to make sure, because again, there's a lot of feedback from developers and citizens on how this should work. This first step is kind of just growth assumptions. There's not a whole lot of.
Right, what the public hearing is tonight, and then what you'll act on at the next council meeting is really just saying, we got the growth, what proposed growth is over the next 10 years, correct? And then what the infrastructure that is needed, capital improvements that are needed to accommodate that growth. And so that's what this document is.
And so the next big kind of public hearing event will be in the summer. I'm just looking at the second to last slide. Is that March? No, wait. Sometime in the summer is when we're.
Yeah, and we anticipate that would be early summer. Then when we start having the public input process with stakeholders, and then the CIC AC advisory committee meeting, public hearings, and then we will. 395, Chapter 395 does require public hearings and ordinance adoption for the city council as well.
And that event will be highly publicized, and everybody will know. If
Yes,
they
sir.
want to weigh in, they show up there.
Yes, sir.
All right, thanks.
All right, and then our last 3 public hearings are all downtown properties that are requesting zoning to C4 zoning, which is our downtown zoning. The first one, 183, is at 910 Webster Avenue. This is the Foundry Warehouse building that's part of the Foundry retail complex here. They originally had bought that building, Zone M2, and we're going to use it for a warehouse, and with the growth of their building, it's turned more into a retail use, so they're needing to upgrade the zoning to meet commercial zoning. It is in our mixed commercial land use designation, and this area has been transitioning from industrial zoning and uses to C4 and commercial mixed uses. And you see all their C4 across Webster and 9th Street from the property. And no opposition on that one, and Plan Commission recommended approval of it. The next one is another downtown property at 401 South 11th Street. This is the old lumberyard property that's been vacant for a long time, adjacent to Jackson Avenue, near Balcones Distillery. Again, in the mixed commercial area that's transitioning from industrial to C4, and then our mixed use core land use designation. You can see there's been C4 coming this direction, and it is in line with that transition, and no opposition on this one as well. And then the last one is 301 and 325 South 6th Street from M2 and C5 to C4. This is the property, the Olmsted Kirk building in the vacant lot that's being used for temporary parking for Magnolia Silos right now. Again, land use, commercial mixed use core land use designation in area and C4 zoning that's been transitioning from the heavy commercial and industrial, and no opposition on this one as well. And that's all we have.
All right, any questions? Okay, are there any requests for future agenda items? That's where we are, right? I don't know where we are on the... If there are no requests for any agenda items, we'll recess the work session for regular session so that we can go into executive session as read into the minutes by our city secretary. I'm making this up as I go along.
Notice is hereby given, the City Council will go into executive session in accordance with the following provisions. 1, attorney briefing, Texas Open Meetings Act, Section 551.071, responses received to requests for proposals, RFP number 2019-052. 2, real property, Texas Open Meetings Act, Section 551.072. 3, economic development, Texas Open Meetings Act, Section 551.087. And 4, personnel, Texas Open Meetings Act, Section 551.074. City Manager Wiley Stem III. We are now in executive session at 4:40 p.m.